Hello, and welcome to today's webinar highlighting how the PAN Foundation supports patients through its comprehensive programs and services. We're really hoping that you will walk away from this video with more knowledge on the financial support that PAN Foundation provides and how pharmacists can access their resources. My name is Lisa Holly. I will be your host for the webinar today. I currently serve as an oncology pharmacist at the Yukon Health Carol and Ray Neag Cancer Center in Connecticut, and I'm also a HOPA ambassador. Today, I'm joined by a fellow pharmacist, James Ridley, who is the Director of Clinical Affairs at the PAN Foundation. James, thank you so much for being here today. To begin, I wanted to talk a little bit about who the PAN Foundation is and what you do. So James, I'm wondering if you could please provide us with an overview of the PAN Foundation's missions and the types of grants that you offer to patients.
Thank you, Lisa. Greetings to all. My name is James Ridley, the Director of Clinical Affairs at the PAN Foundation. The Clinical Affairs Department plays an important role in our mission to improve access to critical medications for patients in need. Our commitment to patient care and strategic guidance drives our organization's success and impact. The PAN Foundation is a leading national charitable foundation and healthcare advocacy organization driven by the belief that everyone deserves access to affordable, accessible healthcare. Through our charitable assistance programs, advocacy efforts, and education initiatives, we remove barriers to treatment, champion policies that expand access to care, and help improve health outcomes for thousands of people each year across the broad ranges of health conditions. Since 2004, we have provided over $4.5 billion in financial assistance to more than 1.1 million people, achieving major policy victories that increase across the access of care, mobilized thousands of patient advocates, and educated thousands more on critical healthcare related topics. We have 3 types of grants available through our 80 different disease funds, over 80 different disease funds. We have copay grants. These cover eligible patients' out-of-pocket costs for coverage medication. The amount of copay assistance and eligibility criteria varies by disease fund. We also offer health insurance premium grants. Our health insurance premium grants offer funds to cover a portion of eligible patients' premium costs. The amount of premium assistance and eligibility criteria varies by disease fund. And lastly, we offer a transportation grant. If a patient already has an active PAN copay or health insurance premium grant, they may also be eligible for a transportation grant. These grants provide a $500 prepaid Visa debit card that can be used to pay for covered expenses for transportation to and from activities that improve the patient's overall health, such as grocery stores, medical appointments, pharmacies, or social support. Covered expenses can include gas, parking, public transportation, taxis, airfare, and more.
James, that's really incredible. I mean, it's a great offering that you have for patients, and we know that so many of our patients are in need of financial assistance. It's really a terrific. We at our institution have used the PAN Foundation for some of our patients. I'm wondering if you might be able to share a little bit more about what oncology-related funds you currently have available.
Absolutely, Lisa. So PAN offers more than 20 oncology-related funds, including but not limited to acute myeloid leukemia, basal cell carcinoma, bladder cancer, breast cancer, chronic lymphocytic leukemia, colorectal cancer, follicular lymphoma, gastrointestinal stromal tumors, liver cancer, melanoma, multiple myeloma, non-Hodgkin's lymphoma, ovarian cancer, pancreatic cancer, prostate cancer, Waldenstrom WM is one of our funds as well, and also small cell lung cancer. And some of these cancer funds have available premium funds that patients can enroll in both. And also, you can review our funds on our website at panfoundation.org/funds. All of them are available on our website. Now, Lisa, I know that pharmacists play a vital role in getting patients access to their medications, especially when it comes to overcoming the burden of financial toxicity. Can you share some examples of the tasks you do on a daily basis to make sure your patients can afford their medications?
Yeah, that's a fantastic question, James. I think it's something that all oncology pharmacists really make as part of their daily activities, as you mentioned. So, some of the things that we do are trying to ensure that we are prescribing medications along with the team, making those recommendations for medications that are needed, that we know are available and have a low possible cost if that's possible. So trying to help direct what we have the patients taking is one big aspect of what an oncology pharmacist does. We also, when a new treatment or supportive care medication is prescribed, we are doing a prior authorization if the patient has insurance, so that we can ensure that it will be paid for and what the copay or the cost out of pocket the patient will have to face. And then when we get that information, we can help determine whether or not the patient really can afford that or whether they do need some assistance and what types of assistant programs are available. So the PAN Foundation is one of those great opportunities that we have for patient assistance. There are also some drugs that can have some assistance from the manufacturers. There may be some opportunities within our own institution for providing some financial support to patients. There are other foundations that are available. There are coupon cards, et cetera. So all of those things are things that we do. In addition to that, we also are heavily involved in creating processes and policies and mechanisms to try to minimize costs upfront as the prescribers are prescribing medications, making sure that we are taking away medications people don't need anymore so that they don't have to keep paying for them and also taking them unnecessarily. So those are just some of the examples that we do.
Thank you.
And, you know, we are, as I mentioned, super grateful for the PAN Foundation and other organizations like the PAN Foundation that help cover these costs of cancer care. I'm wondering, James, if you might be able to tell us a little bit more about the eligibility requirements. So I'm sure not everybody who is watching this webinar today understands all of that. So that would be really helpful, how a patient could get a grant, for example.
Sure. So eligibility varies by disease fund and type of grant. In general, to qualify for a PAN grant, the patient must, one, be getting treated for the disease named in the disease fund, have prescribed medications listed as a covered medication on our formularies for that disease fund. They must have health insurance that covers the qualifying medication or product. I would like to note that health insurance requirements vary by fund. Some funds are Medicare only, and some funds are open to all insurances. They have to have an income that falls at or below the federally poverty level specified by the disease fund. This ranges between 400 and 500%, and the patient must reside and receive treatment in the U.S. or the U.S. territories, also noting that U.S. citizenship is not a requirement for the PAN Foundation. You and also patients and providers and pharmacies can review the individual disease fund and their specific eligibility criteria on our web page under Find a Disease Fund tab.
Well, that's terrific. I know that pharmacists, as we have been talking about, are really in a perfect position on the care team to help patients connect with these resources. And again, we consider this to be a primary responsibility of our jobs. So do you have any suggestions for how pharmacists or our team within the pharmacy could help patients apply for a PAN grant?
Absolutely. So pharmacies can apply for a grant on behalf of their patients, either through our online portal, which is called a PAN portal, or by the phone. We have a full call center that operates Monday through Friday. Also, pharmacies will need the following patient information. They will need the patient's personal and contact information, first and last name, social security number, the date of birth, address, phone number, email address, if available, the patient's diagnosis and the medications that they are on, the patient's health insurance carrier, name, and the insurance member ID, the patient's income, and also the number of people in the household. Our FPL rating is based on the number of people in the household, and that is to determine if the patient is eligible. Also, the provider needs to provide the contact information, the name, the NPI, the email, phone number, and address.
That's really helpful information. I know that one of the things that sometimes we run into is that these funds will close at some point. Maybe the money runs out or there's a time period when the fund is allowed. So what can we do as pharmacists, or what can patients do, or how can we help our patients if a fund is closed?
So actually, we have a great process. If a disease fund is currently closed, patients or the pharmacy or the pharmacist can sign up on the disease fund wait list. When funding becomes available, the patient on the wait list can apply before the grant is open to the public in the order that a patient originally signed up for the wait list. Patients or their pharmacy can also sign up for a cool web-based app called Fund Finder. Fund Finder is a free website that helps you or patients track more than 200 patient assistant funds in 9 charitable organizations that do the work and share the same mission that we do. You or the patient can sign up for an email or text alerts when a disease assistant fund that you or the patient is interested in is open at PAN or other organizations. The pharmacies can sign up, and also patients can sign up at fundfinder.org.
Wow, that sounds like a really fantastic resource. I was unfamiliar with that, so I really appreciate you sharing that. And the other question I have about the funds closing, is it always at the end of the calendar year when funds close, or it can be variable depending upon the fund?
So it is dependent upon funds. Because we are a nonprofit organization, our funding is based on the funding that we get. So when funding runs out, the fund will close. It will open up to wait lists. And when we get additional funding, we notify the patients on the wait list first, and we give them 48 hours to apply for the grant before it opens up to the general public.
That's fantastic. That's really helpful information. I really appreciate that.
No problem.
I'm wondering also if PAN offers any resources that pharmacists or even the pharmacies can keep on hand so that we can, share these with our patients as they're starting new therapies, or just to have as they're waiting to pick up medications if we're working in an outpatient pharmacy.
Yes, I encourage everyone to visit our website at www.panfoundation.org. There's a wealth of knowledge and information that is available on our website. Also, if pharmacies would like for us to send printable PAN's one-pagers, they can email us at info@panfoundation.org, and we will get that over to them. And then also, if pharmacies want pre-printed materials about a PAN patient brochure or about PAN, the information in general, you can email us again at info@panfoundation.org, and we will coordinate getting those materials sent to the pharmacies.
Oh, that's fantastic. Thank you so much. You really have provided some great information today, James. I really thank you for that. Was wondering, we've learned about some policy changes that are coming in 2025. So I'm wondering if you are able at all to touch on the upcoming Medicare reforms that we expect to be implemented January 1st of 2025, and what pharmacists can do to increase this awareness among our patients.
Sure. So there are 2 major changes in the Medicare Part D program coming January 1st, 2025, which could help patients afford their out-of-pocket prescription costs and save money. Beginning January 1, people with Medicare Part D plans through traditional Medicare or Medicare Advantage won't have to pay more than $2,000 over the calendar year for out-of-pocket costs for their medications. All prescription medications covered by Part D plans are included in this cap. There's also a new voluntary Medicare Part D payment option called the Medicare Prescription Payment Plan that goes into effect January 1. This lets patients spread their out-of-pocket drug payments throughout the calendar year, but it does not particularly lower them. Patients can opt into the program both through traditional Medicare and also Medicare Advantage Part D drug plans. You will see an increase in need awareness by sharing this information with patients. You can also refer them to the panfoundation.org/reforms. It is a web page which we continuously update with information regarding upcoming Medicare reforms. And I also ask you all to please look out for our annual Medicare reforms webinar that would take place in November.
James, thanks again for joining us today to share all of these great resources that PAN can offer to patients. And to our listeners, we really hope you found this information valuable and that it will prove beneficial in helping your own patients access the support they need. Please visit panfoundation.org to access the resources mentioned during the video. And don't hesitate to reach out to either the PAN Foundation or to HOPA. And at HOPA, you can reach us by advocacy@hoparx.org if you have any questions. Have a wonderful day.
Take care.